The intraosseous route is also basically like an intravenous route. Why? Because just as I use the intravenous route, I can use the intraosseous route. What's the difference? First, with the intraosseous route, you're going to introduce a liquid directly into the patient's bone, which will be absorbed very quickly into the venous system and will have an immediate effect. So, when you think about absorption, there really isn't any absorption. So, you use the intraosseous route as if you were using the intravenous route, okay? But it's not the intravenous route, it's the intraosseous route. The action of any medication is really fast. When we talk like this, Eder, what is the volume I can use in the intraosseous route? It's the same volume you can use in the intravenous route. In other words, there is no limit. What is the limit for the intravenous route? That's the same limit we have for the intraosseous route. A substitute for the intravenous route, when I can't get intravenous access under any circumstances, I can use the intraosseous route, right? As a last resort, intraosseous route. The first thing I need to consider is in what situation, as a last resort, do I need to use the intraosseous route? It's not for giving an antibiotic, it's not for giving a pain medication. So, you have to think and reason that when you're going to use the intraosseous route, it's an extreme situation where the medication has to be given immediately, at any cost. When I say at any cost, I mean this. I don't care. I need access right now, period. So, the intraosseous route will help in this situation. Alright? So, let's go. A child arrives in cardiorespiratory arrest since respiratory arrest is very common in children. But here I'm giving context. Cardiorespiratory arrest. I need to administer epinephrine, which will help this child come out of cardiorespiratory arrest. So I can't waste time trying to get venous access when the patient needs the medication. So why not use the intraosseous route?